To the story on new health laws. In a change of tune, the government now says Kenyans will determine whether the social health insurance fund deductions will be capped or not. Now, Health Cabinet Secretary Nakhumicha Wafula says the initially mentioned cap of 5,000 shillings has been removed to allow Kenyans to express their views on how far a 2.75% deduction should go. This as the Doctors Union KMPDU, which obtained a court order suspending the implementation and enforcement of the act, states that submissions from stakeholders were not considered by the government. Ayub Abdikadir reports.
The act categorizes households in terms of income, stating that a household whose income is derived from salaried employment shall pay a monthly statutory deduction contribution to the Social Health Insurance Fund at a rate of 2.75% of the gross salary or wage of the household by the 9th of each month. The amount payable each month under sub-regulation shall not, in any case, be less than Kenya shillings 300. For a household whose income is not derived from salaried employment shall pay an annual contribution to the Social Health Insurance Fund at a rate of 2.75% of the 16 proportion of household income as determined by the means testing instrument. The amount payable every month under the sub-regulation shall not, in any case, be less than Kenya shillings 300. The regulations were challenged in court by the Kenya Medical Practitioners and Dentists Union and subsequently suspended until the case challenging its legality is heard and determined.
But when you see the basis of that act, it's actually going to make many Kenyans have impediment, not able to access healthcare as expected.
Until the time that now we have finalized the process, which includes public participation, stakeholder involvement, until we finalize that process and say, now here we have with gazetted regulations, that is the point when we will say, this is what we have put it at.
The president has been very vocal in the push to have salaried Kenyans subjected to a 2.75% deduction on their gross salary, with the health CS seemingly taking cue. Her latest position, however, contradicts her earlier one on the same issue, when she had indicated that the deductions would be capped.
But I also want to clarify. I have seen people saying that, so that means somebody will pay 100,000 plus. No, we have a cap of 5,000 shillings. The minimum is going to be 300, and those who cannot pay, then through the means testing as determined by government, will get subsidy.
For household in need of financial assistance, the authority shall use the means testing instrument in the manner provided in the regulation to identify the households that require financial assistance and for whom the national government or the county government is liable to pay their contributions pursuant to Section 27 of the Act, on capping the amount to be deducted.
Either with a cap or without a cap, Kenyans are going to give us that decision. If we are capping, how much?
All the submissions that we even did to Social Health Insurance Act, none was considered. Otherwise, if that was done, then the act in itself will have been sufficient enough. We will have not taken it to court.
Ayub Abdikadir, Citizen TV.